CBS 47 Eyewitness News in high definition.
Getting cosmetic surgery can come with all sorts of questions, and so this morning we're joined by Dr. James Knoetgen from Beautologie in Fresno with what you need to know before your first appointment. Thanks for coming in.
Oh, thank you for having me.
I'm so fascinated by this whole process, plastic surgery. This is something you do every day.
Yes.
And what do we need to know? What is the big thing that folks need to look out for when they're looking for a surgeon for this?
Well, that's a great question. First and foremost, I think it's very important to choose a board-certified plastic surgeon. It's very important to know that your surgeon's had the right training and the right certification. So a surgeon who's been certified by the American Board of Plastic Surgery is a great way to start.
Okay, and folks may not know this, but there are a few of those here in Fresno.
Yes, there are several board-certified plastic surgeons in Fresno. You can go to the website for the American Society of Plastic Surgeons at plasticsurgery.org, and it lists all the board-certified plastic surgeons here in Fresno.
Okay, and you operate Beautologie, which is located where?
It's in Fresno. It's off of Herndon and Cedar. We have an office there. We also have an office in Bakersfield as well as Malibu.
Okay, well, all right, Malibu, fun. So what are some of the sorts of things that are more popular here in the Valley as far as plastic surgery? What do you see?
We see a lot of breast surgery and body contouring. So a lot of women want breast augmentation or breast lifts, even breast reduction. We also do a lot of tummy tucks and liposuction. We see a lot of people who have lost a lot of weight after like stomach stapling, bariatric type procedures. So we do a lot of tummy tucks and arm lifts and thigh lifts. We pretty much see the gamut.
Getting rid of that excess skin that's left over there. And we're not just talking about women here, right?
No, we're seeing men too. There's an increasing number of men coming in for surgical procedures like liposuction and fat removal from the chest, as well as men coming in for Botox and facial fillers to the face.
And is this interesting to you? Because I imagine a few years ago you weren't seeing guys coming in for Botox.
Exactly.
Things are changing.
Exactly. It's becoming a lot more popular. Some people say with the downturn in the economy, more men are turning to Botox and facial fillers to be more competitive in the workplace, but we're definitely seeing a lot more men come in.
Yeah, are you surprised by that trend?
I was, but it's happening.
It's been around for a few years now.
Exactly.
But boy, things are really changing out there. And so, tell me, what are some of your younger patients? What's the age range there that you see folks coming in because they're not happy with their appearance?
Exactly. Well, for body contouring, we do see a lot of younger women coming in for breast augmentation. They can be in the late teens, like 19 years old, and into the early 20s. And then we also see a lot of younger people who have lost a lot of weight, so they do need the body contouring procedure after losing all that weight. So they'll come in for tummy tucks and breast lifts and surgeries like that.
Gotcha. All right. So look for a board-certified surgeon.
Absolutely. Board-certified plastic surgeon by the American Board of Plastic Surgery. That's very important. And then it's great to meet with your surgeon ahead of time, interview the surgeon, ask them a lot of good questions. How long have you been in practice? Are you board certified? What's your specialty? So it's really good to have an interaction with your plastic surgeon before the surgery.
Now how does that process work? Because in some cases, I would imagine that there are some people who get addicted to this sort of thing, and you may sit down with them and say, you need to calm down.
Exactly. Well, that's why it's good to find a board-certified plastic surgeon, because we're trained in looking out for those things. If somebody has a legitimate issue that can be treated with plastic surgery, and I think there'll be a good outcome, then we proceed. But if there are some issues, like you say, if people start to get addicted or they want too much, that's when we all have to back off and do what's right for the patient.
Gotcha. Okay. Hey, that was really interesting. Thanks for coming in.
You're welcome.
I think we're wearing the exact same suit, too.
Perfect.
So great job on that. Got the memo. We'll be right back. Thanks a lot.
Thank you.